Hello everyone, how are all of you? Welcome to another edition of Doctors Go Live on Columbia Asia Facebook. We hope you and your loved ones are good, whether you're at the office. Okay, today we have a very interesting topic. It's about shoulder pain. That may sound common, but actually there's a lot more to that than meets the eye. We are with Dr Harjeet Singh, who is the Consultant Orthopedic Surgeon from Columbia Asia Hospital, Bukit Rimau. Hello doctor, how are you?
Hi, I'm fine, raring to go. Good afternoon, thanks for the opportunity.
No problem at all. Yeah, we have to get your expert opinion on this issue because I'm sure there's a lot of people out there who would like to know more about shoulder pain because apparently it could be a serious matter and not just a matter of people who are hunched at their computers working. It's a lot more than that. So, before we start, I would like to remind the viewers that if you have any questions, you are more than welcome to just type your questions in the comment section below, and doctor will be able to address those questions right after we finish our discussion. Yeah. Okay, doctor. For the first question, maybe you can let us know what type of shoulder pain is the most common among Malaysians.
Yeah, I think the most important thing to understand is that shoulder pain is not exactly equal to pain at the shoulder. A lot of patients come complaining of pain around that area and they attribute it to the shoulder, but pain which occurs due to neck issues, pain which occurs due to even problems at the chest from the heart also can present as shoulder pain. The idea is that we need to be able to differentiate these kinds of pain. The thing about shoulder pain is that it's common because the shoulder is very important for prehension. That means moving the arm in space. Yeah, and where activity is concerned, without a functional shoulder, you will never be able to do proper daily routines. Now,
Correct.
shoulder pain, if you break it out, you probably can divide them to problems related to the musculature of the shoulder joint. Okay. That meaning the muscles that move the shoulder, including the rotator cuff. These are a group of small muscles that control the finer movements at the shoulder. And as we age or due to any injury or trauma, these can get injured, causing pain. Now, the dramatic kind of pain is pain that occurs due to injury. And these can then injure the structures that stabilize the joint. Often than not, you'll see probably in contact sports like rugby or basketball, you have players who dislocate the shoulder. And there's sometimes you see dramatically they push in the shoulder right at the field of play. And continue playing, I think it's the adrenaline rush. So that's the dramatic acute kind of shoulder injury causing pain. But the most common one is the nagging shoulder pain, which affects sleep and starts off with something mild, which is naturally ignored by a lot of us, and worsens over time, bring them to us for treatment.
Okay. Is that something that happens to a particular profile of patients, or is that something that's general and basically can happen to anybody when we talk about shoulder pain? Is it more occupational?
I think that's a very good way to look at it. If you divide it in a spectrum based on age, the young patient would probably have an injurious nature to the pain. That means there's a history of a contact sport, some gym activities, falling down, some over exercise bringing about the pain. And these tend to be more painful and dramatic, and they tend to come over for care early. Now, the shoulder pain that occurs in the older patient, it tends to be insidious. That means it happens over a period of time. The reasoning being that as we age, the musculature around the shoulders and the structure around the shoulder and even the smaller ligaments in the shoulder, they tend to wear out or are not as functional as they used to be. And over time, causes pain. Now, when ignored, this pain tends to worsen because the condition of the muscles tend to change from just being degenerated, and it moves on to developing a tear of the tendon. And once you reach the point of a tear, the pain worsens, and you tend to develop weakness and loss of function. So most of the time, if the pain is not too bad, we tend to treat on our own, maybe some traditional treatment, ice packs, over-the-counter medication. But if it does not go away, then they tend to come to us.
I see. So basically the lesson there is, if you feel any pain, the sooner you do something about it, the better lah. Don't wait until it gets really bad and tahan, or go for urut or things like that. Is that what you're saying?
Yeah, but the way I look at it is that there are certain kinds of pain that need to be immediately looked at by the doctor. The ones which are related to injury, particularly if immediately you have a restriction in movement of the joint or you feel weak.
Right.
That's like a no-no for self-treatment. Now, if we move on to milder kinds of pain, that aches that you get after exercise, or some amount of discomfort that you feel after a long day at the office, and those which go away just with a simple ice pack or over-the-counter medication, and over time it doesn't worsen, tends to get better on its own, then I think it's safe to self-treat. However, the aim is that if you have pain that doesn't seem to be settling down after a few days, then it's good to come and see the doctor.
I see.
So
Doctor, you mentioned just now. I'm sorry? Say again?
No, I'm okay. Tell me.
Okay. No, you mentioned just now about some restriction of movement. What kind of movements would be restricted if you are experiencing pain in your shoulders? Like, for example, when you lift your arm, or can you describe some examples?
Yeah. The good thing is, generally movements within the limits of normal activity, like eating, typing in the computer, are generally not restricted and they do not cause pain. Overhead movement, you lift it over 90 degrees or overhead, they are the ones that will cause pain. And if you move your arm to the back to probably wear your undergarments or soap the back, those are the ones that the patient, because those are the ones that cause a significant amount of pain.
That's right.
Some do complain of pain when they reach out across the arm. It means if I try to use my left hand to touch my right shoulder, that causes pain. So these are the kinds of movements that cause shoulder pain. Generally, the ones in between, they don't really cause a lot of pain.
I see. And if you were to rate shoulder pain from 1 to 10, which is the least painful and the most painful?
Yeah, I think when we look at pain, right, it depends a lot on the pain tolerance of the patient. But if you ask me to pick one, I think if you have a dislocated shoulder, that is the worst pain that you can actually feel. And unless it's put back in position or reduced, the pain is constant and terrible. The moment dislocation is reduced back into the joint, the pain tends to settle down. I think that's the worst thing that can happen in shoulder.
Oh, I see. So that's like 11.
Yeah, that's 12.
12. That's really painful.
Put it at 12. Yeah.
But it's
because they'll run and come to the hospital.
Yeah, no, when you see the sports persons, when they're on the field, footballers when they're on the field, or rugby players, and then they have a fall and their shoulder gets dislocated, and then a teammate or a doctor will to try to put it back into the socket. It looks very mechanical, so you don't see real pain, because the player doesn't seem to goes back out to the field and he plays again. So it's kind of hard to imagine that this is actually a very painful situation. What do you have to say about that? Just my observation lah. Macam tak sakit.
Yeah, honestly, I don't really understand how they can tolerate that much of pain. But I believe when you're in the heat of the moment, active sportsman, right in the thick of action, I think the adrenaline rush will overtake anything else, and you can control the pain. Besides, you've got cameras looking at you. You can't be screaming in pain.
Kena
And
macho lah.
these athletes which play contact sports, their tolerance for pain is extremely high. Mind you, a lot of them have dislocated that shoulder several times before. So it's sometimes a scenario where you have an athlete which gets several dislocations before they actually come for treatment to stabilize the joint.
That must result in
macho and bravado.
Macho lah. And then off camera menangis.
Macam tu lah.
It's a different story altogether. Okay, Doc. Maybe we can also talk about any tips to reduce shoulder pain, but when you're at home, because of course you're seeing the doctor, then that's not really a problem lah. Doctor can recommend medication and then physio. But if you are at home and you are experiencing shoulder pain, you mentioned just back will help. Other than that,
give you the end.
Hello?
Can you hear me?
Yeah, okay, now.
Yeah, okay, I can hear you now. You were asking me about treating shoulder pain at home, right?
Yeah, some tips, some home remedies that that are proven home remedies.
Yeah, so we scale pain from 0 to 10. Okay, now if you have mild pain without a history of injury, significant injury, there's no fall, no spotting injury, and it probably occurred after you tried to lift a quali from the first shelf downwards and you feel an ache. Then using an ice over the painful area for about 20 minutes, being mindful not to put it directly on your skin helps.
Okay.
Right? But the caveat is that you cannot be having weakness with movement, which indicates that the injury is probably more severe than what you think it is. Or you have restrictions significantly in all directions of your joint, which means it's worse than you think it is. But I think using ice packs, simple pain meds such as paracetamol is safe. And if the pain goes away and you don't feel weak, there's no tingling running down your hand, there's no weakness, then I think you're good to go.
I see. What about posture?
Again, easily. Yeah, if it happens again immediately after or it worsens over time, then please go and have a look.
Can posture affect our shoulders as well? Can that cause pain?
Yeah, definitely. Now, if we look at posture, like I mentioned just now, shoulder pain and pain at the shoulder are two different things. A lot of us have desk-based jobs, and we tend to get pain at the nape of the neck, moving down to the shoulder, and that is most likely going to be due to posture. And the problem is very rarely at the shoulder joint, but probably at the neck. And most of the time, it's because of office ergonomics. That's one. The second thing is, some of us, they have very poor core muscle control of neck, upper back, and the abdomen. And all that also contributes to pain around the shoulder. So posture is very, very important. And if you identify that you have poor posture and get that sorted out, most of the time the pain goes away. So it's not all the time, we're going to say that this pain is severe and serious and we're going to need to do something more than just physiotherapy and correction of posture.
And perhaps would you advise using a pillow that can actually support your neck properly? Will that? I mean, of course, that would be recommended, a proper pillow. But does that affect the shoulders, or is that more to relieve the neck of pain?
Yeah, so ultimately it depends on what is the exact diagnosis causing the pain. Now,
Mm.
if you have neck issues that
Mm.
are brought about by inappropriate height of the pillow
Yeah.
or sitting positions, that will definitely go away.
Okay.
Now, a lot of patients tend to have pain at the shoulder due to rotator cuff problems when they sleep on the affected side, on the side. And that pain tends to be mild initially and then it becomes worse over time, giving them sleepless nights. And I guess
Mm.
simple change in posture or position of sleep would help them. So it always depends on what's actually causing the pain.
I see. Okay. Can shoulder pain reverberate and affect other parts like the neck or the head, or does it give you migraines?
Yeah, so pain due to conditions at the shoulder does move down the upper arm, but
I see.
usually stops short of crossing the elbow. So if you have a rotator cuff problem, whether it's a tear or wear tear, it tends to
Yeah.
cause pain coming down the outer part of the arm and sometimes right up to the elbow, but it's very uncommon for it to cross the elbow. So
Okay.
when we speak to patients and they explain that their pain are going across beyond the elbow joint, running down to
Mm.
the palm of the hands, and if it's also related to some amount of burning pain and there's tingling and numbness, then we normally
Mm.
move off and say that this pain is possibly from the neck, and we then examine the neck to try and pick out the problem. So
I
if it
see.
shoulder pain, but it moves predominantly to the outer part of the arm.
I see. I see. How are shoulder injuries treated? I know that's a very big question, but does it usually involve surgeries, or is it something as mechanical as what we mentioned just now? A matter of
Yeah,
just
I think
putting the bone back into the socket.
yeah. So contrary to popular belief, orthopedic surgeons do not operate everybody. Okay, we
Mm.
tend to give you a whole um, spectrum of options based on
Yeah.
the kind of condition that you have.
Right.
A lot of shoulder conditions can be
Mm.
treated appropriately with pain medication, physiotherapy,
Yeah.
some alteration in your activity for a period of time,
Okay.
um, keeping away from the predisposing spot or activity that causes the pain in the first place.
Mm.
And as you improve over time,
Yeah.
over a period of maybe 3 or 4 weeks, we normally restart your activities gradually. That's most of the patients. So that's about 85% of my practice. The other
Okay.
15%, they tend to need something more. We
Mm.
have worked out their problem.
Mm.
We gave them the option. We thought that they get better with physiotherapy and they don't. Then the other options include injections into the affected area,
Yeah.
uh, sometimes some amount of anti-inflammatories like steroid injections.
Yeah.
And if that doesn't work, some of them do need surgery. Okay,
Mm.
so that's the way things play out. Now, there are situations where surgery is normally discussed from the word go. So if you have
Oh.
a very bad tear of your
Mm.
tendon and you come in extremely weak for the movement
Mm.
specific for that tendon, then normally your orthopedist will say, hey, the tendon's totally torn and in all probability you will need surgery to get better. So that's one scenario. Weakness is a big no-no.
And those
The
are
second
usually
scenario,
caused by accidents, lah.
yeah,
Or
so
something major like that.
yeah, so those happen in two groups of people. One is the active middle-aged athlete with the injury,
Mm.
or the older patient who over time has developed a degenerative tear,
I see.
probably caused by some trivial injury and
Mm.
causing bigger problems like weakness. So that's one of the subset. The other
Right.
subset is
Mm.
pain that is not going away with medication,
Mm.
especially when we have isolated the cause to be due to a shoulder pathology. So I think those are the ones that normally need surgery. But
Okay.
most are easily managed without.
Sorry, you're saying?
Yeah, but a lot of them can be managed without surgery.
I see, I see. But what's the worst case scenario? I mean, not to be morbid or anything, but what's the worst case scenario for shoulder pain? Just so we can let the viewers know that don't take shoulder pain
Yeah.
so lightly, lah. You know,
So
in case it's something
I
that's
mean,
been happening over time.
yeah. So the way, I mean, if you're older without a history of injury and you
Mm,
develop severe shoulder pain, which affects your sleep at night, doesn't seem to go
right.
away, and it's worsening over time, we have to look at the rarer conditions which cause shoulder
Yeah.
pain, right? It could be a
Right.
tumor sitting at the upper part of your humerus. So
I
that's
see.
worst case, morbid, scary scenarios, but these are extremely rare. But whenever you see an orthopedist, the most important thing is questions that he asks you and the answers that you give, because that guides us to what possibly is the cause. So
I see.
the imaging, the X-rays, the ultrasounds, the MRI, they come second. The story is the most
Yes.
important. Yeah.
I see. I see. I see. So it's
Younger patients, if they dislocate their shoulder and they are extremely athletic, they tend to need surgery to stabilize or repair that part so that the shoulder can function well again.
yeah. I think they're superhumans because even after surgery and then not long after they go back out into the field and they until they get whacked again.
Yes, they do. Yeah, that's the
Superhuman.
job. That's the job.
Yeah, that's the job. So they don't really have a choice. Okay, doctor. Because we mentioned this in our intro paragraph. As long as
Okay.
at
Yes.
work, something. Okay. Do you know that shoulder pain can mean something as serious as spinal cord injury or even a heart attack? So how? Maybe you can just
Yes.
comment a little bit on those because shoulder pain is a symptom.
Okay. If we look at heart conditions,
Mm,
uh, there are some scenarios where a patient comes with left-sided chest pain moving down the arm,
mm,
and he initially attributes it to some activity that he did the day before or not. But
right.
you tend to, if you ask the story again or you ask the
Mm,
history well enough,
mm,
you tend to then pick out other red flags, like
yeah.
they say that they are nauseated, they have
Uh,
a feeling of they tend to they have sweats at that moment. The pain
mm,
is always related to some activity, and there's also a chest tightness. So when I have those kind of scenarios, I do tell them that, hey, you know what, we need to screen the heart. And I'm
mm,
fortunate enough that I work in physician just next door.
yeah. Yeah.
That's one of the scary scenarios. And I
Mm,
mentioned earlier that pain can present predominantly as shoulder pain or shoulder going up to the head.
yeah.
So that's something that we speak to.
Okay. Okay, doctor, if one has a nagging shoulder pain, can you demonstrate to us? I mean, not lastly, but what are the movements or what are the activities that they should not do if you have shoulder pain? Do's and don'ts. Yeah, let's talk about do's and don'ts now.
I think the first is these overhead movements.
Mm,
They tend to trouble you quite a bit.
okay.
Um, bring it down. Sometimes it's okay, but you are trying to take from the upper shelf. You will notice that it becomes increasingly painful and difficult to do.
Mm,
Right, that's one. The second thing that I notice a lot of patients come to me is that sometimes to reach out and
mm.
pick something from the back seat of their car. That means they are in
Oh,
the
yeah,
front seat,
yeah.
they use their left arm
That's
and
right.
try to carry their bag from the back. Yeah,
Mm,
and that can be something heavier,
mm,
often related to one of the tendons in the shoulder, which is right in front, the biceps tendon.
yeah.
So naturally, when we do these activities and it causes pain, we tend to naturally avoid it. Yeah, but some of these movements are movements that are needed for everyday life. So ultimately, they will tolerate the pain for a while, and after a while, they say, hey, no, I need to get this looked at.
I see. Okay. Okay. That's a good piece of advice. Okay, now we have come to the end of the talk, but we do have quite a few questions which we will be addressing now.
Oh,
First of all, I just would like to inform you that
right.
you've got a lot of fans out there. So many people are saying hello to you. Hi, Dr. Harjeet. Hi, Dr. Harjeet. Some thumbs up,
Hi,
some
hi,
smile
hi.
faces.
Oh, okay.
Okay, we have Miss Surinder Kaur.
I thought I wouldn't. I thought it was going to be a
Sorry?
quiet session.
No,
I
not
thought
at
it was
all.
going
Not
to
at all.
be a session. Yeah.
Okay, Miss Surinder is asking what is a home remedy for frozen shoulder. Maybe you would like to just explain first what is frozen shoulder?
Yeah.
What is that?
Yeah, I think this is a common problem and a good question. The medical terminology for frozen shoulder is adhesive capsulitis.
Okay.
We explain conditions where there is a reaction of the tissue within the shoulder,
Yeah.
causing inflammation and tightening up movement of the
Mm.
joint over time. So
Okay.
the sometimes it's caused by a trivial trigger, just a small injury causing a bit of pain, but the
Mm.
shoulder and its nerves overreact, causing more inflammation than there should be. Now, the thing about shoulder, not every shoulder pain or restriction of movement is
Mm.
frozen shoulder. Frozen
Mm.
shoulder explains the scenario where there is restriction in all directions,
Oh.
and it's a painful condition initially, and over time the sickness gets worse and worse, but the pain tends to come down. So the idea in treating this condition is
Mm.
appropriate control of the pain. That's the first thing.
Yeah.
Okay, because then you try to break the cycle of that painful condition moving into
Mm.
the freezing or stiffness stage. Now,
Mm.
once you come in a little late and there's a
Yep.
lot of stiffness, you tend to need therapy to try and reverse those stiffness to get some good range of motion.
I
And
see.
there are a lot of exercises that are taught by the therapist, and these are exercises that can be easily done at home. Some of
Mm.
them are if you use your hand to crawl up a wall slowly
Mm.
to get
Mm.
range of motion. So these are actually designed not to be done in the hospital. It's to be done at home several
Yeah.
times a day, gradually, not all at once,
Yeah.
within the limits of your stiffness to try
Yes.
and reverse it. Yeah. I think frozen shoulder is something that if you are diligent in doing the exercises at home, you can be taught and you can do at home.
I
But
see.
mind you,
Mm.
not all stiffness at the shoulder is frozen shoulder. So this is one condition that requires an accurate diagnosis by the doctor.
I see. I see.
Yes.
No, when you have shoulder pain, does it usually happen to both shoulders at the same time or not necessarily?
Yeah, no, not necessarily both the shoulders.
Mm.
I do get patients who come with pain at one shoulder and
Mm.
has been treated, got well, and over a year or so comes with pain on the other shoulder.
The
I
other
mean,
shoulder.
I've never, yeah, it's very uncommon to get it happening at both shoulders
Mm.
because it tends to happen at your dominant arm first.
Right. Right. I see.
Yeah.
Okay. We have Ms. Zafira Mawardi. Her question is, hi doctor, sometimes I'm having severe shoulder joint pain with limited range of motion.
Okay.
Yeah,
Yeah.
take it away.
So you look at Zafira's statement. She says she's had this severe pain without any injury. That means there is no significant injury, and over time she has developed some limited range of motion. So this is the one
Yes.
that possibly sounds like adhesive capsulitis or a developing frozen shoulder.
Yes. Mm.
So in patients who have severe pain without injury,
Yeah.
Especially if they are of a younger age group, we tend
Yeah.
to view this with a lot of attention and severe. I mean,
Mm.
we tend to pay a lot of attention in this kind of groups because we want to know what's causing the severe pain, and we try to
Yes.
reverse it as soon as possible. So
Yeah.
pain relief, uh, moving across the spectrum to then work on the stiffness. So this is the way adhesive capsulitis or frozen shoulder present.
I see.
Yeah.
Okay, we hope that answers your question, Ms. Zafira. Okay, here's another one from Encik Zai. Doctor, is it a serious symptom when shoulders and arms feel numb when sleeping at night? Only felt it on one side, the right hand side. What can be done to avoid it?
Yeah. So okay, if we look at it, you have problem when you sleep on one side, the right side. So you do know that there is a position that causes your problem. So if
Mm.
you change position, I'm sure it'll go away to a certain extent. But coming to the way your problem presents, I've explained that shoulder pain predominantly, you have pain lying on the side. It's caused by rotator problem,
Right.
but additionally, yours is causing you numbness, which
Mm.
in all probability means that there is also an associated problem with the nerves, probably at the neck or somewhere around the shoulder. It is not predominantly a shoulder problem.
I see, I
So
see.
sometimes when we have neck issues like a simple spondylosis, which is
Mm.
wear and tear of the structures around the neck, and there is
Right.
impingement or irritation of the nerve, certain postures will cause numbness. So now
Oh.
avoidance of those postures help.
Mm-hmm.
But if the numbness is getting worse over a period of time, these are the
Yeah.
group of patients that need to be seen by the doctor.
Right. Okay. We've
So
got another.
avoid the positions
Sorry.
that causing it. And I think if your problem goes away, then well and good. If not, come over.
Okay. All right. So that was for Encik Zai. Miss Zafira Mawardi has another question. Hi, doctor.
Oh,
I sometimes have severe shoulder joint pain with limited range of motion. Okay, this one we addressed already just now.
yeah, yeah.
But she adds on, I don't have any history of accidents or any other injuries on the shoulders. This issue can be due to what problem, doctor? Usually I will think, I'm not sure what this is. I guess it's a name of a drug. You
Yeah.
would know better.
But you see, yeah, this drug is, I think, normally not easily available over the counter. So there has been a doctor probably prescribing it.
Okay, okay. Then
Although,
maybe we won't go there lah.
yeah,
Okay. All right. I think maybe this question has already been addressed just now, as you mentioned that it might be frozen shoulder. Yeah. So we'll just move on to the next question from Ms. Sheila Muhammad Tahir. Hi, should we still experience pain in the morning, although we already slept on an organic mattress made for back pain? Oh, okay. So this is about back pain. Would you like to address it? I will just leave it to you, doctor.
uh, you see, after a restful rest, we shouldn't have any kind of pain, right? We should get up very fresh and happy. Now, sometimes we tend to get a bit of stiffness, lower back, and that stiffness after a short period of time or a warm pack goes away.
Yeah.
It can happen if you've had a long, exhausting day and your
Yeah.
core muscles are not very strong. So it's something simple. But if this pain is relentless, recurrent, increasing in severity, we know that it's not just a simple kind of pain.
Mm.
And when the pain is not simple, we need to get it looked at. So you've changed your mattress, it's organic. I don't really know what an organic back care mattress is exactly. There are a lot of orthopedic low back specific mattresses which work very, very well according to the advertisement. But I guess if that's not working, then please get to the bottom of your pain.
Okay. Okay. All right. We'll take one last question here from Ms. Rubini Tayaniti. Will steroid injections help with chronic pain, and how long does it last?
Wow, very good question. Difficult question to answer. Now, earlier in my talk, I said that, okay, therapy or care or treatment of shoulder pain, it depends on the diagnosis, and it's never, it's most of the time, never surgical from the outset. A lot of things can be treated without surgery, just simple postural correction, modification of lifestyle and therapy.
Yes.
Now, often there is certain other conditions like if you have a rotator cuff issue where there is inflammation of the rotator cuff, some wear and tear, but no over tearing of the muscle. And these are often treated with steroid injections into the area of inflammation. Mind you, it's not only the injection that helps you, it's the injection and also correcting the conditions that caused it in the first place, like sleeping on the side, overhead movements, and the like. Now, if you take the injection and it helps the acute problem, that means what's happening, the inflammation, you will feel good, but there is a tendency of the problem coming back. Okay? So you will, if you address it with the injection, if it's appropriately done, and you do the exercises to strengthen the structures around the shoulder, I don't see a reason why it should come back, unless the diagnosis wasn't right at the beginning or your problem is something which is recurrent. So I think that most of the time, appropriately given injections last for a good period of time.
Okay, all right. So that was very interesting. I think we've come to the end of the program. Okay, so thank you so much, Dr. Harjeet Singh. That was very informative. Dr. Harjeet Singh is the Consultant Orthopedic Surgeon from Columbia Asia Hospital, Bukit Rimau. And hopefully we will have another chance to talk to you again and we can address other orthopedic topics.
Doctor, thank you very much. Thank you very much for the opportunity.
No problem at all. Our pleasure. Thank you. Okay, bye everyone. Have a good afternoon.
Bye.
Thank you.